So let's talk a little bit about total hips.
Okay, good surgery. I mean, if I had to have any joint replaced, hip,
It would be the hip.
definitely.
For sure.
Yeah,
People do really well.
They do really well, and
Yeah.
it's really a good surgery.
Yeah.
So give us the update.
Yeah, well, you probably all know somebody who, or maybe you've had a total hip replacement, and hopefully it's been successful. Of course, no surgery is perfect, and there's always outliers, but by far, it is a very successful surgery. And you've probably, just a quick overview, there are a few different types of total hip replacements that can be done. And what I mean by that is approaches to joint entry. So the hip's a big joint. So some surgeons like to approach it more from the front, some more from the side, and some more kind of from the side back area. And over our careers, I think we've seen the trends kind of change, and that's a common thing in medicine. Something becomes popular, we learn a little bit more, they change their approaches, surgeries get a little bit better, technology gets a little bit better. But right now, there's the approach going more through the front of the joint is probably kind of the gold standard at the moment. So not all surgeons do it.
And the reason is they're trained.
Mm-hmm.
You know, and so a lot more, I think, now are being trained in anterior.
Yeah, anterior, lateral, kind of. But for so long it was posterior, lateral. But the finding out what your surgeon does ahead of time is important, and having a conversation with your surgeon about maybe why they do that approach. The idea, if the kind of the trend right now is going a little bit more through the front because you don't go through as many muscles. So you're saving more muscles. So it makes the recovery easier, because if you have to cut through some of the bigger muscles with some of the other approaches, it's a little longer on the recovery time. So I would suggest talking to your surgeon. And if you're in an area of the country where you have access to several orthopedic groups, I would maybe get 2 opinions and have conversations with each of the surgeons.
And ask them how many they do. The more they do, the better your outcomes will be.
Yes. And there are surgeons who are more generalists who do shoulders and hips and knees. Maybe if you want to find a surgeon who specializes more in hips than everything. So I think that's a great point. And you want to have a good rapport with your surgeon. So personal choice matters when you're talking about going through surgery. And then thinking about a pre-op physical therapy visit. So there are going to be some exercises that could be beneficial for you going into the surgery, learning how to do those. And then you can also learn from your therapist what to do immediate after post-surgery. So you have like a little jump on your recovery after the surgery because you're already going to know what to do.
Another little thing to help you on the jump is there was a study that showed if you did 10 hours of luminosity, which is a brain game that you can play on your phone, you actually do better cognitively after your surgery.
Ooh, for any surgery.
Any surgery.
Interesting.
Yeah, but like if a hip fracture, you couldn't have done it because you wouldn't have known. But for an elective surgery, you can actually do it. And I've had several patients that I've suggested it to, and they loved it. You know, they felt they were a little sharper than, I had one guy that this is his 3rd total knee. They messed it up, but he felt, not only did he feel better after this one, but he felt a little sharper in the head.
That's really interesting. So I do have a lot of people after surgery, they're like, oh, I can work from home in a couple days, but they can't because mentally they're a little not quite back to their sharpness. So that's a great point. And then one more point I want to just touch on is there is a little bit of a trend right now for physicians to not send you to post-op physical therapy after a hip replacement. And I really don't agree with that. And not just because I'm a physical therapist. You might feel good. You might regain your ability to walk and strengthen on your own. But inevitably going into a hip replacement and coming out, you had muscle imbalance. If you had a hip that was very arthritic and not moving as well on one side as the other, there's long-standing biomechanical issues there that need to be addressed post-op that you need to see a physical therapist for. So if your physician happens to not recommend post-op physical therapy, ask for it. I mean, it's your body, it's your health care. You can ask for it.
It is paid for.
It's paid for. Your insurance is going to cover post-op physical therapy for a hip replacement. So even if it's just a few visits, push for it.
Yeah, I agree. Great point.
Yeah. All right.